If you're in healthcare, you already know that ABG stands for Arterial Blood Gases. That's right, that absolutely critical test that has always seemed almost impossible to understand until now. Hi there, my name is Dr. Larry Romaine, and if you're going to be caring for critically ill or critically injured patients, I've written a little book that you really do need to read. It's called Simple as ABG. Believe me, blood gases have never been this simple before. As background, I'm a career emergency physician. I've been in practice for over 35 years, and yes, if it matters to you, I've been board certified 4 times in that specialty. Lots have changed in emergency medicines over my career. CAT scans and MRIs had not even been invented when I started. But some things never change. If that patient who is right in front of you right now looks really bad and really critical, the 3 things you start with are A, B, and C. A, is his airway open enough to get air in and out? B, is he breathing through that airway well enough to get air in and out? And C, is his circulation good enough to pump around the oxygen and get rid of the carbon dioxide? Back when I started my career, and today, if the ABCs do not look good, there is only one test that will give you the information you need, and that is a blood gas, also called ABGs or arterial blood gases. The good news, no other test that you can order will give you as much information on that patient's immediate life-saving strategy. The bad news is blood gases are painful, they are hard to draw, they are expensive, and until my book, they were very difficult to interpret or to teach other people to interpret. Years ago, one of my experienced ER nurses was helping me care for a very sick, very septic, shocky patient in the ER. I had ordered blood gases and the results had just come back. The nurse asked a question about the blood gases. I explained why they were the way they were and why this was going to change our management. She said, "Wow, Dr. Romaine, I never understood that before. You really ought to write a book on this." So that's exactly what I did, and Simple as ABG is the result. In writing this book, I had 4 goals in mind. Number 1, I wanted to keep it short. Nobody wants to read 200 pages on blood gases. Simple as ABG is only 96 pages long. Number 2, I wanted to use large print. Nobody wants to wander through fine print trying to understand a difficult subject. As you can see, the print in my book is large font, and it's actually written in a blue ink, which makes it a little bit more comfortable to read. My third goal was to use pictures, charts, or simple graphs to try and reinforce the learning from the written part of the book. Over half of the learning pages in this book have one of those visual aids to try and help students remember things after they understand them. And last, I wanted the book to be certain to give students some relevance to patient care. This isn't just about learning about a blood test, this is about learning to take care of patients. Because of that, the last third of this book is 8 real patient case studies where blood gases, shall we say, saved the day. Okay, just how simple is Simple as ABG? Let me give you an example. When I show you this, at first you're going to think this is a child's toy truck. But in Simple as ABG, this is not a toy truck. This is a hemoglobin molecule, and you can tell because it has 4 iron atoms in the bed of the truck. The purpose of those iron atoms is to combine with 4 oxygen atoms, which would rust the iron. Because there is no oxygen on this truck, the truck is silver gray, bluish gray, very much like a cyanotic patient. Once the oxygen combines with those 4 iron sites, the truck is rusted. And yes, that is exactly why healthy people are reddish pink and cyanotic people are bluish gray. It really is that simple. Now, my editor for this project was Ted. Ted has been a friend of mine since high school, and unfortunately he knows almost nothing about medicine. But he knows so much about computers that he was one of the co-authors of the original software that made it possible for small banks in the United States to have ATM machines. What Ted was able to do with simple as ABG is to make this book available in two different versions. There is both a $9.95 electronic version, which is available through Amazon.com on the Kindle platform, and there is a $20 printed version. Either way that you choose to read simple as ABG, I think once you read it, you will agree blood gases aren't complicated. They're really just as simple as ABG. Thank you.